Hi, this is Dr. Connie Casebowl of Form Health Greenville, and I'm here to talk about what if you're in a situation where it's your partner or spouse going through menopause. How can you be the best support for that person? Well, it's true that you're affected because if you're married or in a relationship with someone going through menopause, it affects you because she is probably going to have some moods, maybe anxiety, maybe irritability, maybe depression, maybe insomnia. She may have a lower libido, which is going to affect your own sex life. So these are things that can affect you. So looking back, when I was in college, my mother was going through menopause. My father was a physician and still didn't know what to do. So ignorance was just as rampant back then as it is today. They initially gave her anxiety medication, which kind of turned her into a zombie. She started slurring her speech and she was on too much medication. Finally, one doctor took pity on her and said, "Mrs. Casebowl, you're low in hormones. You need to get on some hormones." So my mother finally got on the therapy that she deserved. But honestly, if you are in a relationship with someone going through menopause, do your very best to gently but firmly encourage them, seek expert medical advice on what to do. Because although there are herbs and dietary approaches, nothing quite works like hormones. And it needs to be bioidentical hormones, not synthetic. And sadly, the GYN doctors who should be the experts admit they have no training in this. So GYN doctors are taught to manage GYN surgeries and obviously pregnancies, but not the postmenopausal woman's hormone needs. So again, do your very best to get them into a practice like ours, where we take a careful history, we look at labs, and we come up with solutions that are good for the patient's health. So not only will your spouse or partner get an alleviation of her hormone symptoms, but hormone therapy helps women live longer, lower rates of heart disease, lower rates of breast cancer. Yes, I said it. Lower rates of breast cancer, lower rates of dementia, improved bone density. So many things that affect both your quality of life as well as your quantity of life. So don't delay. Get your partner in to see someone like us because we can help.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.